Here is a brief overview of VirtualDoseDX, an accurate radiation dose management tool for standard radiographic studies. After a successful login, the main web-based interface will be displayed. There are several input parameters entered from the main interface to describe the X-ray exposure. Note that if you place the mouse on top of a parameter, a brief explanation will pop up. The user must first select a virtual patient from the Patient Phantoms drop-down list. VirtualDoseDX has 21 virtual patients in total, including 50th percentile adults, pediatric patients of both male and female at different ages, pregnant females at 3 gestational stages, and a set of obese male and female patients. The Phantom can be selected directly from the Patient Phantoms drop-down list or by entering patient biometric information manually. Clicking the magnifying glass will reveal inputs for patient sex, age, height, and weight. The patient is assumed to be lying on a 2.15 mm aluminum equivalent thickness operating bed. The projection drop-down menu is populated with a number of standard X-ray examinations grouped into categories. Selecting the down arrow reveals the categories, and the right arrow beside each category reveals the available examinations within that category. Selecting one of the options populates the values of the rest of the parameters, which can then be modified if necessary. The angle of the X-ray beam relative to the virtual patient can be adjusted manually using the sliders for the rotational angle and the tilt angle. For the rotation angle, 0 degrees corresponds to the posterior-anterior direction. As the projection is updated, a representation will be displayed on the virtual patient in red on the front, side, and top projections. The position of the X-ray field on the virtual patient can be adjusted by click and drag, or the size can be adjusted by grabbing the handles at the edges of the field. Note that the dimensions represent the size of the field at the image receptor. Tube voltage and copper filter thickness are entered in the entry boxes on the screen. The acceptable ranges are 55 to 120 kVp and 0 to 0.3 mm copper. Entries outside these ranges will be set to the maximum or minimum. Users should note that in addition to the copper filtration, there is an inherent 3.5 mm aluminum filter applied to all X-ray tubes that is not selectable by the user. 2 reference distances are specified: the source-to-imager distance and the source-to-skin distance. There are 5 options for specifying the output of an X-ray: entrance skin exposure, exposure area product, entrance air kerma area product, and milliampere seconds. If you change the selection from the drop-down menu, the value field will update to the equivalent value in the new unit. 2 sets of tissue weighting factors, ICRP 103 and ICRP 60, are available. Based on the selection, the appropriate methodology for calculating the remainder dose and effective dose will be used. When all of the parameters are set, users can click the Calculate Dose button, and the results will be immediately plotted and tabulated below the phantom images. Optionally, users can click Create PDF Report to download the dose report in PDF format. The format includes the exposure parameters used for the calculation, a schematic of the patient phantom with the exposure field, and the listing of organ dose results. Selecting the checkbox in the upper right corner of the data entry panel marked Multi-Exposure opens a list box where multiple individual exposure events can be saved so that the patient dose summed across all events can be calculated at once. Clicking the Add button will create a line marked with the projection and X-ray output value that holds all of the exposure parameters. Each time the button is selected, a new line will be generated. Once one or more lines appear in the box, clicking on a line will return the exposure parameters to the values stored in that line. If the parameters are modified, clicking Save will update the stored values. Clicking Remove will remove that line from the calculation. When the desired lines are saved in the multi-exposure box, clicking Calculate Dose or Create PDF Report will provide results for the aggregate of all exposure events.